right. I am so honored and really humbled to have a special guest on our Facebook Live celebrating APA Heritage Month. I'm proud to introduce Doctor and Professor of Medicine at the University of San Francisco. I'm sorry, University of California in San Francisco, Dr. Tung Nguyen, to join us today. And Dr. Tung Nguyen is also a community advocate. He served as a member and chair on the commission advising Asian American, Asian Pacific Islanders under the Obama administration as well. So welcome, Dr. Nguyen.
Thank you, Jack, and thank you everyone for having me come join you.
You know, please, tell us about yourself, and we'd love to learn about your journey into the medical field.
Sure. I'm Vietnamese American. I came here to the United States when I was 10. Actually, April 30th was the 45th anniversary of my departure from Vietnam. And I'm currently, as you said, a physician, a teacher, a researcher, and an advocate, primarily around the area of Asian American health. I'm a professor of medicine here at UCSF, and got into doing medicine mainly because when I was younger, I had family members who were sick, and I was actually because they didn't speak English, and the healthcare system wasn't particularly culturally and linguistically appropriate for them. As the bilingual person in the house, I got to help out and do translation and help navigate my family members through the health system, and that got me interested in health, but also in looking at the issues that Asian Americans had getting good health care and obtaining health.
Now, can you share with us some of the research that you've worked on over the past decade, and perhaps some of the trends that you've been seeing relating to the APA community?
Yeah. The field of Asian American health is really only about 25, 30 years old, because before that, people just didn't have any data about Asian Americans. The American government and almost the healthcare system were not collecting information on Asian Americans. About 25 years ago, we found out that there were some disparities for Asian American, one of the most significant of which was cervical cancer disparities for Vietnamese American, which is my community. But also hepatitis B and liver cancer for most Asian Americans. And a lot of our projects since then have been focused on working with patients and communities to identify potential causes of issues around cancer disparities, healthcare behaviors, and how to improve them. And a lot of our projects have been designed to go into the community and making sure that the community knows a lot more about these issues, but also to make sure that they get the right healthcare, get cancer screening when they need to, get hepatitis B screening when they need to, get smoking cessation help if they are a smoker, which is a big issue for Asian American immigrant men in particular. So that's what we've been spending a lot of our time doing. We also have done some work using traditional media approaches, lay health workers, which is a traditional social network approach to help create community change. And also recently, we're doing a lot more mobile technology work to address health disparities among Asian Americans.
Now, I got to bring it up. We're doing the APA Heritage Month celebration all virtually because there is a pandemic happening. With the backdrop of COVID-19, what are some research that you've worked on pertaining to the community?
Yeah, that's great that you brought it up. This week, some medical students at UCSF and I just published online an evaluation of some of the data that we have. As usual, data on Asian Americans are pretty sparse across the country, but the data coming out of San Francisco and California suggests that while we're getting COVID infections about the same as the general population, there are more deaths among Asian Americans than would be expected. So that's just the finding, and the question is why that is the case. And it actually turns out in 8 other states, Asian Americans have higher proportion of deaths compared to actual cases than the other population, the general population. And so there are lots of potential explanations, but of course we don't know what they are yet. One possible explanation is that we're just not getting tested enough. So the actual disparity is that the number of cases are actually higher than the data show. That's one of them. The other is that, of course, there might be something real going on where Asian Americans who get COVID are dying more from it. Just need more data, more research to figure out what's going on there. Obviously, we also been looking a lot at anti-Asian American racism, uh, both as a social phenomenon, but also because being exposed to that particular stressor of racism is not good for our mental health, right? So we want to make sure that we're looking at some of these issues as we are dealing with the pandemic itself.
I know you kind of touched on it. What are some preliminary kind of next steps after the brief comes out?
Oh, after the brief comes out, I think we want to be working with our community and our advocates. Number one, to ask for more data. I mean, I think we can't really answer the questions that I've just raised without additional data collection. So, for people to fund the data collection, to collect the data, I would like to see a little bit more data that's also disaggregated by national origin groups. So, for example, we know that Asian Americans are highly represented in the field of healthcare workers. So 1 out of 6 doctors and 1 out of 11 nurses are Asian Americans. We know we have a strong population of Filipino nurses, for example. If we could break down the data by country of origin, like Philippines or Vietnam or China, we might be able to identify even more issues that we need to be working on.
Yeah, I know everyone's talking about COVID. We're not going to focus all on the COVID-19 on this conversation, but just to kind of wrap up, what are, from your vantage point, what is your prediction as we gradually reopen California and the rest of the country? Question one. And question two, for those that, want to make sure we stay healthy and safe, what are some of your advice?
Yeah. Well, I'm concerned. I mean, I know that we have to reopen at some point. I like the phased in approach to see how things are going. The problem is that we haven't really met what a lot of public health and policy people consider the criteria needed. One of which is we want to start seeing declines in daily infections. That has not really happened. And as a matter of fact, California is beginning to creep up in terms of the number of infections, so that's kind of worrisome. And also, we want to make sure that our healthcare system is adequately set up to deal with the next wave of infection. So that means, do we have enough ICU beds? Do we have enough ventilators? Do we have enough masks, personal protective equipment? Are we able to do what we call contact tracing? Or do we even have enough testing kits to apply? The jury's out on all of that. And so what worries me is that we'll reopen and then have another spike and our system won't be able to handle it. And then we'll be back in the same place as we were before. As far as what we can do individually, I certainly think that mask wearing outside of the home is absolutely necessary. I think we should try to continue to maintain physical distancing of 6 feet or more. So as we sort of resume our regular lives, I would encourage people to really make continually risk-benefit analysis. Do I really need to go there? Can I, batch all my stuff so that I can just go to the store once a week instead of multiple times? So making these kinds of conscious risk-benefit decisions, because once you get COVID, it's a real bad problem, both individually and for the rest of your family, right? You have to be able to isolate, which many of us can't. We don't have the housing situation or the resources necessary to do that. And then we put our family at risk. So really encourage people to make sure they don't get infected. And of course, dealing with the stress of both economics and the social isolation, and then going back to work with, all these things piling up, taking care of our own mental health with exercise and, talking and seeking help is necessary.
Yeah, thank you for sharing that. I feel like there hasn't been enough coverage on individuals that have gone through COVID. The procurement of supplies needed once you catch COVID and the quarantine aspect. It's quite daunting. So I'm really glad you're sharing that with everyone. Switching gears a little bit, want to focus back on you. What was the aha moment when you went from realizing you got to go beyond the medical, your immediate profession, to advocacy work?
Yeah, so I started out taking care of patients, and that was very rewarding, and it continues to be rewarding. But when you take care of individual patients, you do know that they're exposed to problems that they can't solve and I can't solve, and so these kind of systematic problems need to be addressed. So I decided to address it initially through data and research. But once you get the data and the research, the next question is always, how do you fix the problems that you find? It's hard for individuals to fix problems. We have to fix problems as a community. So Asian Americans, broadly speaking, haven't really flexed our advocacy and policy muscles as we could. And so I felt like that was sort of what we needed to do. My first real exposure to that was when we were trying to solve cervical cancer disparities among Vietnamese Americans. And what we found was that they weren't getting the PAP test because they didn't have access to culturally and linguistically and affordable
Right.
primary care. And the only way to get that for them is to advocate through our community coalition at the state level. So they actually went to the state and actually got some funding and things like that. And that's when I realized the power of working with communities as a researcher and as a doctor. Eventually, though, it felt like I was kind of punting that work to the community. I really wanted to do that work myself, so I got involved a lot more in advocacy and policy, and that's why I ended up serving on President Obama's advisory commission on Asian Americans and Pacific Islanders, because I felt like in that position we could actually work with the federal government to do a lot more for our communities through the inside track and the government track, as opposed to what our advocates and our organizers were doing outside of the government. So that was really where I got committed in this work.
No, no, thank you for sharing. I think part of what we're trying to do here at APA Heritage Month Foundation is to get more young professionals or professionals in the corporate world to network and really advocate to have a seat at the table of breaking that glass ceiling. We talked about it a little bit earlier. What are perhaps some lessons or experience that you went through in the medical field that is also applicable to the corporate world in trying to break that glass ceiling?
Yeah, you would think that there isn't a problem in medicine, right? A lot of Asians we know are doctors, but it turns medicine there's which is that we have lots of Asian American students and young professors and physicians, but we don't have a lot of Asian Americans in leadership position, what we call at the chairs, deans, chancellors level. So the glass ceiling exists there as well. I've been trying to deal with a lot of that. And one big lesson is, of course, we have to work together. Those who are sort of in the position to do what I call the inside game, working with the leaders to convince them to do the right thing, have to do it that way. And then those who are not in those positions but are on the outside can also exert pressure through public, petitions or whatever. We have to work together. Like the people who are organizers are making loud noises outside, and the people who are in the inside are trying to move things ahead. But the other thing that I've learned is that sometimes Asian Americans tend to set themselves up against other racial and ethnic minorities and say, well, I'm not getting this because this other group is getting it. And we put ourselves in this weird competitive position. And that doesn't really solve our problem, because I think what the other minority groups are facing and what we're facing are actually from the same root causes. And the root causes of that is racism and socioeconomic inequalities. And until we can learn to work with our fellow minorities to address those root causes, I think we're all going to be in the same boat. So.
Yeah, coalition building.
Yes, absolutely.
Yep. Yeah, no, thank you for sharing that. Now, I know we stressed it a few times, it is Asian Pacific American Heritage Month. I know we talked about earlier, you feel that it goes beyond the word heritage. Can you tell us more about that?
Yeah, heritage is great, right? Heritage is what you're given by your family and your ancestors, right? But I just want to make sure that when we celebrate heritage, we don't just get stuck with what was given to us and where we were and where we are now, but we are looking forward and making sure that the heritage that we pass on to the next generation is even better, right? So how do we do that? I mean, in 2020, I think this is the year of a lot of things besides the pandemic, which of course had thrown everything off. But two of the biggest things that's happening in 2020 is the census, which actually determines everything in terms of our community, because without good census data collection, Asian Americans are squeezed out of everything. And particularly without good census data collection disaggregated by national origin group, some Asian American groups may get squeezed out. So we need to make sure that we get our community to answer the census and make sure that everyone answers the census. But the second part, of course, is the elections. I mean, I think what we need to do is take
Right.
a look at what our leaderships are doing in terms of addressing important issues, including the pandemic, in terms of how they relate to Asian American communities, and act accordingly. Make sure that we have leaders in position that will help us maintain the great heritage and not have us go back to the bad heritage, like the days of Japanese American incarceration or the Vincent Chin murder and all this other stuff. We don't want to go back there, but we are kind of there with the rising tide of anti-Asian American racism based on the pandemic. So what I encourage people to do is look back fondly, but look forward and work really hard to make sure the future is better.
That is a great reminder. Sign up, make sure you fill out the census and get out the vote in this November. Dr. Nguyen, I know you got a jet. Thank you so much for what you do, and thank you for just spending a few moments with us here at APA Heritage Month Facebook Live. I appreciate it. Thank you so
Well,
much.
thank you very much for asking me, and have a great celebration.
Yeah, thank you.
Okay, bye-bye.